Hello, this is Dr. Marcia Blazer. Ever since the story of the oral surgery practice where hundreds of patients may have been infected with hepatitis was in the news, many of my patients have been asking about how we sterilize and disinfect our dental tools. I thought it would be helpful if I spoke briefly about some of the measures we take on a daily basis to protect our patients. The workhorse in any dental or medical practice is the autoclave. This is what is used to sterilize all of our tools. The autoclave works with a combination of high heat, steam, and pressure over a period of time. It's used many times in the course of a day over and over again. There are tests that we perform to make sure that our autoclave is working properly. First, the bags in which the instruments are placed have a colored dot at the top. Before the instruments are sterilized, the dot is pink, as you can see in this picture. After the instruments have been treated in the autoclave, the pink dot turns brown, as you can see in this photo. We know then that the tools in this bag are sterile until we open the bag. We test the autoclave further with little sealed tubes containing bacterial spores. Some tubes are treated in the autoclave and some are not. The tubes are then allowed to incubate in a warmer for several days. The tubes that were not treated in the autoclave change to yellow, while those that have been sterilized remain this purple color, as you can see here. It may seem like overkill that we do all these tests, but it's important that we feel confident that our equipment is always working properly. That's what we do behind the scenes. What do we do that you can see for yourself? Well, all surfaces are treated with a surface disinfectant between every patient. We wipe down the dental chair and the counters in between patients. You can see the disinfectant-soaked towels covering equipment that cannot be sterilized. You'll even notice that some of our equipment is covered with disposable plastic that can be discarded between patients. I'm really proud of the steps that my office staff and I take to make sure we protect our patients as well as ourselves and our families. I hope that you feel comfortable asking your dental or medical office about what they do in their offices. Thanks for listening.